Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
All right, everybody, welcome back to Healthy Living Tuesday. Now, tonight we are discussing sports injuries dealing with the knees and ankles. These types of injuries, of course, are extremely common in athletes. In order to treat the cause of pain, it's important to have an evaluation and proper diagnosis. Joining me now, as she always does, the very lovely Dr. Jitka Lom from Express Care. Doc, thanks so much for being here.
Thank you.
All right, so we are talking ankles and knees. Can you explain first, I guess we'll just start off, what are the mechanics of the knee itself and then the ankle?
Okay. Well, you know, the knee has the thigh bone attached to the leg bone.
Which you probably had to memorize when you were getting your doctorate.
Yeah, the tibia and the fibula. And the way it's attached to the top bone to the two bottom bones is through a crossway ligament. That's the ACL or the PCL that you've probably heard of. And then there's also two strap ligaments on the side that hold things together. So your knee is held from going back and forth, those two bones on top of each other, and then from side to side. And it's very stable when it's used as it's meant to be used, which is in moderate activity. But when you have a strong force, either applied from the side or from the front, or a lot of twisting, that's when the injuries occur.
How delicate are they? Because of course, you know, with age, and like we've been talking about on this program for years now, it's, you know, the effects of time, you know, take over and tend to break down the human body. But how delicate is that? Because you see sports athletes get, you know, knee injuries.
Yeah,
all
and
the
they're
time.
very fit people. It's just the load, the amount of force that's applied is huge. So especially for people playing rugby or football, you know, they've got 300 pounds of muscle, you know, attacking their knee, or in extreme skiing injuries, those type of injuries. Even soccer, there's so much force and twisting that the knee will buckle and give. But normally, the knee is extremely sturdy, and that's why people can climb Mount Everest, you know. That's a long way up.
Yeah, you figure you're putting your entire body weight on it, so I mean, it's got to be pretty strong. Yeah. Now, can you differentiate maybe between, and of course, ACL being is anterior cruciate ligament?
That's right.
And MCL is
the
medial?
Medial collateral ligament. The collateral ligaments are the ones that are the straps on the side, and the cruciates are the ones that are crossed in the middle.
Okay, so what's the difference between either of those and then injuries involving the patella, so the actual kneecap itself?
Right, so the kneecap is kind of sliding in front, of course, of the knee, and that one can slide sideways, even get dislocated, but basically that is separate from what's happening on the inside of the knee with those ligaments. But the entire structure, you know, it is flexible but sturdy, and just depends what kind of force will be applied to it as to what kind of injury it can have. With young people, they'll often have patellar dislocations or movement of the patella because it's very, very soft. Still, the ligaments are quite soft, and they can slide easily.
Now, what is the physiological purpose of the patella, you know, besides, you know, men getting down on bended knee and proposing to their special ladies?
That's true. Well, actually, it does protect the front of the knee. It's a bony protection for when you kneel down, and so that instead of the front of your knee, sort of the front of your femur or the front of your tibia being injured, there's like a bony pad there. That's what it is.
Now, by the way, of course, we're talking about medicine, but on a literary front, I have no idea why people always say on bended knee, because it's on bent knee, people. Don't mean to insult those of you who are Boys to Men fans, but, you know, it should be on bent knee. Okay, getting back, how fast can one recover from typical knee injuries?
Well, it just depends. If it's a minor sprain, it'll be a couple of weeks, 2 to 6 weeks, with ice, rest. Those are the things: ice, rest, wrap it, and take some Motrin or another anti-inflammatory like naproxen. A couple of weeks. If it's a more serious injury, it might be much longer than that, especially one that needs repair, like an ACL repair. The recovery time is actually about a full year before you're allowed to go back to your other activities.
Okay, so that's a knee. What about the ankle, though? How complex a system is that?
Well, the ankle tends to be a little bit more fragile, again, because it's a thinner, smaller bone. Set of bones there, and it's easily sprained. That's the most common injury, an ankle sprain. Ankle breaks tend to occur with, again, extreme force, with a kicking or with a severe, severe twist. But as far as how delicate are they, they're quite sturdy if you don't have those extreme activities going.
Yeah, again, for those people that appreciate, and you know, the engineering that is the human body, both the knees and ankles are load-bearing joints, I guess you would consider?
Yes, they are. And what's interesting is that they're, of course, connected to your hips. And your hips actually are very, very important in keeping the knee in alignment, and also making sure that the force is applied correctly down to your ankle, and that goes all the way down to your feet. So if you have flat arches, your ankles will start turning in, so will your knees start turning in, so will your hips, and you'll have pain going all the way up over time. So it all starts with your feet, actually.
All right, so if you appreciate anything about bridges, it's a fascinating system. But I tell you what, we have some fascinating questions that were sent to us, so sit tight. We will be right back. We are talking knees and ankles with Dr. Jitka Lom from Express Care when we return on Healthy Living Tuesday right after this.